Welcome to Not Silent Podcast. I am Arbana Xharra. Artificial intelligence is rapidly transforming healthcare, changing how diseases are diagnosed, how treatments are recommended, and how medical decisions are made. But as technology moves faster than regulation, critical ethical questions are emerging. Can AI reinforce human bias? Who is being protected and who could be left behind? Today's guest is Dr. Vijaytha Murali, a researcher whose work on healthcare AI and algorithm bias has helped shape international conversation involving the WHO, CDC, UN, and FDI. In this episode, we explore the promises and dangers of AI in medicine, the risks of biased algorithms, and why the future of healthcare may depend not only on innovation but on ethics, accountability, and human rights. Dr. Murali, thank you so much for joining us.
Thank you so much for having me, Arbana.
Can you tell us about your journey and what first inspired you to work at the intersection of healthcare, artificial intelligence, and ethics?
Yeah, of course. So it's been a long journey. I've been practicing as a doctor now for over 10 years. I started off training in the UK, and some people may know that in the UK we have a free healthcare system called the NHS. And through the NHS, we're privileged to be exposed to a wide range of patients from different socioeconomic backgrounds. And I think that that was my first spur of, asking the question of how I could contribute to making technology more accessible to them. And in medicine, for several years now, we've been using technology on various different levels, right? From X-rays to EMR and note-taking systems. And so that kind of incitement landed when I started practicing. But I would say the bigger incitement actually happened when I went to Kenya, and I volunteered there for 2 months, and I treated kids and their families with several different conditions. And that was really the aha moment where I saw the impact of delayed diagnoses and delayed care on a really profound level. Many conditions that were being missed were simple conditions that on the day-to-day doctors see every day. I really had the burning desire from then to do something about it. And I had always had a background and an interest in innovation, and marrying the two became my dream. And at that time, I was offered a wonderful opportunity to move to the US and do a AI in healthcare postdoctoral fellowship in Stanford. And there I really got to work with amazing inspirations in the field who were really designing the questions around AI in healthcare and also designing the answers. Because at that time, when I started in 2021, it was just when AI in healthcare was starting. And I got the opportunity to work with big companies such as Google Health and really got to see firsthand how they design algorithms, but also got to speak on the policy side. And since then I was hooked, and my work largely now focuses on child health and AI, but also looks at vulnerable populations as a whole in AI.
So many people hear the term AI in healthcare, but don't fully understand what it means. So how is AI currently being used in medicine today?
Yeah, good question. I would say several fold. Now, just over the last couple of years, AI is being used in the community through consumers and patients asking a lot of health questions on ChatGPT. So that is first and foremost probably the biggest one. But I would say that in the medical world specifically, we are looking at algorithm usage for diagnosis, for treatment, but also to help with administrative tasks such as note-taking, such as discharging patients, and also monitoring patients in the community.
Your Accept AI research gained international attention from organizations like WHO and CDC. What was the main problem your research aimed to address? If you can go more into details about your work.
Of course. So I think when I was working at Stanford, it became really important to me to understand how we could make technologies both accessible to vulnerable populations, but also exciting to vulnerable populations. Because I think there is this quandary, right? Like, we know that the people that need the technology most are the vulnerable populations. And by that, I mean patients that are traditionally a little bit harder to access or a little bit more ethically complex. So children was what my research focused a lot on, and I'll go into that in depth, but also women, also people of color, and also people that are geographically limited, be it in rural areas or be it in developing countries. And really, my mission became how to bridge innovation with equitizing technology for these groups. So when we talk about Accept AI, which was the first framework that I developed that focused on equitizing technology for children, I noted that prior to this work that there were several algorithms in healthcare that had been developed that were inclusive of children, but not specifically trained or made for children. And that is a huge potential issue that has largely been overlooked. And the reason for that is that traditionally the children especially have not been the primary focus of much of research funding for several different reasons, because they are a harder population to reach. And what we aim to do with Accept AI was to bridge academia, industry, and clinicians with a key goal of how to communicate with each other when we're building things for kids. So Accept AI is actually a very simple framework that any viewers can access in any industry and use it to ascertain how they can safely involve kids in it. And, the main pillars of Accept AI are simple things like know when you're training an algorithm what age the end consumer is going to be. Know when you're training an algorithm that adult healthcare data is very different from pediatric child healthcare data. And if you train an algorithm that is meant to perform on children with adult data, then you can get very different results, because ultimately the algorithm is only as good as the data that it was trained on.
So when you said you went to Kenya and you had this idea of starting this, so can you make a comparison of countries that are more developed to other third world countries?
Yeah, I think global cooperation is such an important issue as we develop AI for healthcare. I think what is happening now globally is that a lot of the exciting tech is being developed in the developed countries, but isn't reaching the developing countries. And we know that 80% of disease burden is in developing countries. So I think that in itself is a form of bias. And maybe the term for that people have alluded to in research is a geographical bias. So there's this huge need to represent lower income countries in this massive shift that we're having in the technological world and the innovative world. But then there is also this huge issue of fragmentation of culture and fragmentation of policy. Different countries and even different states in the US have different policies when it comes to consent, when it comes to child consent, when it comes to data sharing. European laws are very, very different from American laws. And so the second biggest issue, in my opinion, that we're trying to tackle is trying to bridge some of those gaps. And I think the only thing that can bridge those gaps is communication between leaders of several different levels in different countries.
So having in mind that there is a lack of awareness on the importance of this, which I would like for you to, one of the concerns you have raised is, as you mentioned, algorithmic bias in healthcare. So, but people don't really understand. So in simple terms, why it is so dangerous, because trying, as I mentioned, also these other countries, because there are so many parts of the world that they don't have access to internet yet. So can you explain as I mentioned, the simple terms on why it is so dangerous?
Yeah, I think algorithmic bias is purely put in very simple terms an AI chatbot or a program functioning incorrectly on a certain population because it's not been trained to treat that population. So for example, I guess another example would be you go to a certain doctor for a certain condition, you go to lung doctors for lung conditions, you go to heart doctors for heart conditions. If the AI is trained on the lung instead of the heart, but you're looking for treatment for the other organ, then it's going to go wrong. And so, very simply put, algorithmic bias is the potential for error in an AI algorithm.
But how can this impact older adults, women, minorities, and as you mentioned, also people of color? Mostly they are left aside. So can you get more of details?
Great question. So when we talk about people of color, it's probably the simplest example to start with. We have several wonderful AI algorithms that have been developed to analyze skin conditions in different skin tones. Unfortunately, people of color are harder to recruit for clinical studies because often they live in harder areas to reach, more rural areas, even within the US, or they live in the lower and middle income countries, which are harder. And so ultimately, we end up programming an AI algorithm with a lot of Caucasian skin, which is not trained to activate its power on darker skin. But then we know that there is this need gap, that the actual algorithm usage and the need is higher in patients with skin of color. So we know from many research studies that when we have used the same algorithms on patients with skin of color, that many of the diagnoses that it's coming out with are incorrect. So that is the danger. And the danger is that people are going to trust that the algorithm is catered to them when it's not. And when it comes to older adults, children, and women, again, it's the same issue of if you think about children and older adults, it's harder to get their training data because they may not have the capacity to consent themselves, for example, particularly patients with, say, dementia and cognitive issues. And for children, most of it is parent supported. So it requires parental consent to be able to do anything. And therefore, we run into the same issues where algorithms can be used on them quite freely because they are licensed to do so, but they haven't been trained on them. And then there's that element of trust because the end user trusts that the algorithm suits them when it may not necessarily suit them.
Yeah, we were talking about it's going so fast, the technology and the AI. Not just children, but also parents are really not aware that they need a consent for their children. So are there steps that we should start considering first on raising awareness and also investing into these parts of uh, population, which, as you've mentioned, are really not engaged. They are mostly on the rural places. So what are your suggestion or policy that the government should start working on the different levels of raising awareness?
Yeah, I think you're exactly right. I think there are different levels of it. I think on the most basic level, when we're talking to industry partners, I think that very simple things that they can do is if they are going to involve children in any devices, there should be clear consent pro forma, and it should also be very, very clear to users where the data is going. Is the data going to be sold to third parties? If it's parents that are going to be using it predominantly, can the parent delete the data? Do they own, who owns the data and where it goes? I think that it's a very simple thing to do, is just being a bit more upfront in terms of building. And I would also say that on the wider topic of algorithmic bias, it's important for builders just to be aware of the sorts of biases that they may be building into the algorithm. Much of it is done in innocence. It's not done to, build programs that are not accessible. I think just simple awareness that, oh, okay, if my product is going to serve adults and kids, have I made sure that I have built those assumptions into my programming? It's as simple as that. And similarly, if my algorithm is going to be used in the US and in Africa, have I made sure that I have tried, in good conscience to make those accommodations to fit? And if you can't make those accommodations for whatever restrictions that the builder may have, then it's just important, I think, to warn the end user, just say that the data has been trained on this sort of data, and if you feel like you have not been adequately represented or that the algorithm has potentially given you a wrong diagnosis or something that you feel uncomfortable with, there should be clear feedback mechanisms. So I think that the first part of raising awareness actually lies with the consumers and also with the builders. And that's the part that's working really fast. So actually, it's very easy to do that, right? Very simple to do that. I think the harder, question is representing it on more of a national and international scale. And I think for that, it just requires ongoing conversation. And it also, I think, really requires a common goal between different people of different political backgrounds or different nationalities to really bridge into a common goal of equitizing technology for good. And I love innovation. I love the pace that innovation is going at. But I think that there is a way to do it ethically. And I think that there is a way to do it in a way that's conducive globally, really, because we know that technology doesn't have borders, right? And we also want, I think the main goal is for AI to be human centered. So I think that ongoing conversations and also just on a practical level, updating policy guidelines to reflect, current issues. Also ensuring that vulnerable populations, because often their needs are different. Like I've said with children, the vulnerable populations, another example is rare disease populations. So patients with, uncommon diseases that are often very, very difficult to diagnose. And there may only be a few hundred of them in the world, but they are one of the populations that need most from innovation. They need the innovation the most. But again, their needs are very different. And I think that policymakers need to just be sure that when they're making policies that they're looking at all these different elements and are not excluding anybody from the conversation.
I don't know if you agree, but also policymakers have the lack of information. We have seen at the Congress, they were asking some questions related to the technology that you could tell that they are really not informed. And in this case, people should be protected by policymakers. But how are they prepared? Because the builders are going to try to expand their product as fast as they can. So I don't think they're going to be on the side of the consumer. So who is going to protect these people, and are they capable of protecting them?
I think that my opinion on this is actually very simple, and it's something I've thought a lot about too. So I'm glad you've brought it up. I think that there needs to be community voices that activate both on the policy making end, but also the building end. For example, if you are building an app that's for older adults, then make sure that the app is built by consulting people who are caring for older adults, often their children or their spouses or the older adults themselves. And similarly, if you're building for children, make sure I really strongly believe that children are going to be the biggest users of AI, but also the biggest creators of AI moving forward. So don't be afraid, whether you're a policymaker or a builder, don't be afraid to just ask. Right. And it's those populations that are much more knowledgeable about, even from a business incentive, about what is right to build for. And I think that when we make policy, and big part of Accept AI is community, like really building community around whatever you're building may give you so many solutions that you don't realize.
Yeah. So your work has influenced conversation at the FDI and International Health Organization. So the fact that you have started this, what is the level of the policy impact you have made?
I think it was surprising. I would say that when I was asking these questions, I didn't necessarily anticipate that there would be so many people from different industries that resonate so much with the work. It's hard to measure, I think, impact in the short run, but I will say that our work has been featured as part of the WHO international policies. It has influenced how the FDA thinks about licensing new AI algorithms and has helped, I think, bring that diversity metric into play. And I hope that in the longer run, it influences people in other communities, such as, your community of media or the legal community, for example, to utilize those same principles, because the principles aren't limited to healthcare. So I think that my dream would be to, if people are building, if they can just ask themselves, are we representing vulnerable populations? And if not, how can we do it better? And how can we seek their feedback? I think that would be the biggest impact that I would wish for.
Yeah, what it's very important to emphasize that the WHO and UN have begun discussing global cooperation on healthcare AI. From coming from media background, I know the importance of the cooperation when it comes to everything. So especially also in AI, as we said, there is such a huge difference between the continents and the countries, and how it is important to, when regulating these technologies, they cooperate together, because you cannot have a same standard in the United States and other parts of the world.
Yeah, I think that's right. And I think the answer is you can't have the same standards, but I think you can have the same conversations, you know? And I think you do have the same issues. And so I fully believe that there is scope to delineate what can be agreed upon based on deeper humanitarian values versus what requires flexibility for that specific population. And I think that there are just basic things that can be agreed upon. And I also think that it's particularly important, I think, to ensure that the lower and middle income countries are not neglected from the conversation, because ultimately they may be the biggest end user of what we're developing.
What are the biggest ethical risks we face if governments and tech companies move too fast with AI in healthcare without proper oversight?
I think that we risk scaling more harms than good. I think honestly that's the biggest risk. Again, I want to say that I think all the innovation is really exciting. I think it has so much potential to prevent disease. I think it has so much potential to discover new drugs. I think it has so much potential to expedite diagnoses. But I think that simple measures can prevent harm. And on the topic of harm, I think it's very, very important that every AI company, in my opinion, has the mechanism for end consumers to report potential harm that they faced because of it. And we see that when it comes to the space of mental health, and that's been spoken about quite widely in the media. But I think that having those mechanisms and tracking those mechanisms over time is the due diligence that every country, continent, and developer can make to make AI more ethical.
You probably, of course, in your study, you have a lot of case studies that show this risk. Do you have any interesting case to share with us that has impacted
Yeah,
the
I
suggestion?
I think definitely I've worked a lot with skin and dermatology algorithms. The algorithms that I have worked with performed better on lighter skin with more accurate results. I would say that. And also one of the key questions that came to mind when we formed Accept AI was whether AI algorithms were performing appropriately on x-rays and also heart scans of children in comparison to adults. And there are several papers now that say that AI trained on adult x-rays do not perform the same on children. And I think those are two examples, but we see it all the time in clinical practice in the day-to-day. You see all the time that patients have asked GPT a specific question, but that the question isn't necessarily tailored to their background. So simple things like how frequent is this condition or how likely am I going to have this condition can be very, very different depending on your background, your age, and so forth.
So when we talk about, I would like to clarify this for our viewers. So how can patient know that they have the right to know when AI is being used in their diagnosis of treatment decisions?
I think patients should always know that there is a chance that AI has been used in some point of your health care, because now it's becoming so prevalent in healthcare that often it's just embedded into the note-taking system, for example. And I think that that transparency can be really broad, but is important. I don't think that it's practical or necessary for them to know all the technical details of where and what unless they want to, but I think that they should know that there is some inference. But I do want to make the point, though, that as far as healthcare is concerned, still largely, the ultimate decision is still with the clinician. And I think that it's also important for patients to freely be able to say to the clinician that, AI told me this, and is this true or not? And for that to be alleviated, I think that the real value of AI in healthcare is in clinical augmentation, not clinical replacement.
So usually when we go to see the doctor, they give us a bunch of papers to sign, which they can probably not like, I don't know how likely will people go into those. They're going to just
Yeah.
sign. So
Yeah.
legally the clinic will be fine, right? Because you already signed. I don't think they have time to go. How can we simplify this for people and patients to understand and not sign something which they are not aware of what they are signing?
I think they should still have the trust and it should be communicated to them if otherwise, but ultimately the clinician should be able to say that AI may have been used somewhere along the journey, but I'm making the final decision in conjunction with you. But I think that just a simple bullet point to say that will cover that, and also it being echoed from the clinician. I think that patients still have a large amount of trust in the medical community. And I think that many patients are also excited about the innovation. So I think that just making it simple is all that needs to be done.
What is the difference you see because you are in Europe and also in the United States? Do you see differences between EU policy and United States?
I think that, I mean, my legal knowledge is limited, but there are huge differences as far as the GDPR, the European data protection laws are concerned with regards to deletion and storage of data. I think that the European laws mandate more strongly that patients and trial recruits can withdraw their data, but that's as much as I know. And then the other thing, of course, is that consent and assent laws for younger populations are different even between Scotland and England, and certainly between the US and the UK. So those are two important things that I personally think about quite a lot.
Do you have a feeling that in the United States is more often policy making based on the interest of the companies rather than people who are more vulnerable?
It's a difficult question because I do think it changes depending on who's making the policy, quite honestly. I do think that there has been a lot more accommodation of just because researchers like myself and others have been fiercely advocating for this. I think that there has been more awareness globally, but I still think that there's work to be done honestly universally on this issue of ensuring that vulnerable populations' voices are incorporated into policy making. I think it's been a long-standing issue before AI, and I still think it's an issue now.
What are your suggestions or on the level of raising awareness? So where should we start? Within families, universities, what community should be getting more?
I think all communities should get involved. I don't think that there is a baseline of technical competence or technical education that is required to talk about AI. I do see that people fall into a spectrum. Some people love it, some people hate it, and that is okay. But I think everybody needs to be aware of it. I do think that parents should be telling kids or talking to actively discussing AI with kids. I think that is hugely important because if you don't, the kid knows anyway. And I also think that, I think advocacy, I think everybody can be an advocate for, safe AI, right from women to men. And I think that when you and I met, we were at a conference called Peace Pays. And one of the most beautiful quotes that I heard from them was that, the strongest builder, I think, builds from a place of unconditional love. And it sounds cheesy, but it's true. I think that building because you care is the strongest form of advocacy.
You've mentioned parents talking to children, but I have an impression that children know more these days
Yeah, I
than
think it's right.
parents when it comes to AI. At that meeting that you mentioned where we both met, so we've talked with so many young people that are aware of all of this, but sometimes you meet people that are still not using AI. So sometimes you are shocked with those that are aware and the large number of people that are not really aware of anything. So I think that we are coming to this stage of having more, hopefully, people get involved into this field. So for young women and students interested in science, medicine, or AI ethics, what advice would you give them about entering this field?
I think the biggest advice is don't be afraid to use your voice. I could have never predicted that my work would go to the level that it did. And I think that everybody has a unique relationship with technology that can be communicated directly into policymaking. And I do not underestimate what your life experience can bring to the table when it comes to technology, I would say.
Yeah. And what worries you personally the most if we fail to act responsibly?
Again, yeah, I think the biggest fear is that we're going to unleash a lot of algorithms that make mistakes. And on a practical level, lose sleep about at night is technology making incorrect diagnoses or reassuring patients when it doesn't. I think that's my biggest worry. But I do believe that with simple things, simple feedback mechanisms, simple tracking of adverse events that every AI is going to have, every algorithm is going to have mistakes in it. And also just the awareness that we should always test our assumptions and make sure that our own personal biases aren't programmed into technology is an easy way to circumvent that.
I have one question. In the case of misdiagnosis and the patient is going to sue the clinic, or do we have legal capacity to deal with these cases right now, considering how fast AI is developing?
That is a great question. The answer is I actually don't know. I think that, I think the way that most countries are doing it at the moment is that ultimately, regardless of what AI says, I think it is the clinician that is responsible. I don't think from what I have seen on the clinical floor that patients and end consumers are blindly testing AI when it comes to diagnosis or treatment as of yet. So, legal frameworks and accountability frameworks, which is what you're referring to, I think still have to be strengthened. And I don't think anybody knows the answer yet, which is why I think that while the technology is super exciting and the pace of innovation is strong and potentially very, very beneficial, I think that there is still the ultimate responsibility for the doctor and the patient to trust the human side more with AI as an adjunct.
Because the legal part is very important. The whole point is like if they misdiagnose or do something without the consent. So what is at the end, those are gonna sue whoever they don't know what to do. So I think that in the meantime we have to work also in that regard, because this way you can also raise the protection to the patients. If you know that, yeah, you're going to sue me, you're going to lose billions of dollars, and then I'm going to be aware since the beginning, also the builder and those who are using the system.
Exactly. And I think the problem currently is that on that chain of responsibility, nobody knows where to place it if AI does go wrong. And that is the problem. And that's why that even, the multi-billion dollar companies are still saying that the patients or the end consumer can't put their full trust in the technology, and that if there is any doubt that they should still go to their clinicians. So I do believe that we're still in a phase of evolution for that, and I think that answers will become clear over time, and I think they will become more clear as clinicians we see more and more AI usage in our populations as well.
Unfortunately, I will think that since we've mentioned that most vulnerable category of population are people of color that are more poor, that come from the lower class. So it's going to be problematic, because if they're not going to be aware of the consequences, and if these are the parts that are not being invested, and they are the most vulnerable category.
I think that's why the global conversation becomes so important, and that's why it's so important that the lower income or global south countries are part of the conversation. At least during the time I was collaborating with the WHO, again, people from lower and middle income countries that people would assume do not have that digital literacy often do have a lot of insights on how the technology would best benefit their community. And one very interesting insight I took away from one of the earlier conferences I went to on that note was that often they want their own community leaders to be the ones that are perhaps more digitally literate and are able to communicate that to their wider communities, because different countries work on different cultural hierarchies. And I think that identifying who those people are within the different cultures is probably one thing that political leaders could really do very easily that would hugely help that global conversation.
But we have an example of ChatGPT, how people got so fast involved into. I think that we could find the ways for them to raise awareness and not to fail in this regard.
Yes, I think so. I do believe so.
Thank you so much, Dr. Morales. It's been a pleasure to have this conversation, considering how important it is. And unfortunately, we don't see as many debates in this regard. So being open to talk about this is very important. Thank you again.
Thank you so much for having me, Arbana. It's been a real pleasure.
Likewise.